Hi, this is Jill Schiaparelli. Welcome to HealthTech Talk Live, being broadcast worldwide on iHeart Radio. We're here on the floor of the UBM Canon Medical Design and Manufacturing Conference in beautiful Philadelphia, Pennsylvania. We're talking to innovators and experts in med tech, and I have one of them here with me today. Dr. Randall Chitwood is an internationally renowned cardiothoracic surgeon. He's had an amazing career, been very influential, been president of multiple societies, and has now made the leap into the world of industry. He's currently the Director of Surgeon Relations at Direct Flow Medical in California, and we're delighted to have him here today. Welcome.
It's great to be here, Jill.
We're very excited.
Huh? Well, it's nice to be here.
It's an amazing innovation world we're facing right now. Tell me a little bit about what Direct Flow Medical does and what excites you about their technology.
Well, I really got interested in this company because basically they're doing a entirely different aortic valve for percutaneous aortic valve replacement, which we call TAVR, transcutaneous or transcatheter aortic valve replacement.
And why is that clinically significant, especially with your background?
Well, it's extremely significant because basically we have a number of very high-risk patients now that can undergo a surgical operation where you open the breastbone or even do a small incision because of their comorbidity, so to speak. In other words, they have kidney failure, all these other problems.
Very sick patients.
So the idea is to be able to put a valve in via the femoral vessels, the groin vessels, so that we can replace that valve without having to do a huge operation. And this particular company has a very unique valve. It's developed on, it's a fabric with polymer based rather than stent based or metallic based with leaflets that are made of bovine or cow pericardium. But the idea is it's made of a polymer, not just a metal.
Well, and you were speaking on that here at the UBM conference.
I did.
So let's talk about that. Most of the older versions have been metal. Now you're switching to a polymer. What's the significance of that?
Well, even more, the modern versions are still metal, but the idea is once you implant these valves and expand the metal ones as a stent, it's very hard to reorient them or take them out if it's not going well.
Understood.
The idea of the Direct Flow Medical device is to be able to reposition, do an echo to make sure there's no leak. Let's say there's a little leak, then you can reposition the valve and get it perfect, and then you inject, of course it's got something you can see on the x-ray machine, and then you inject the polymer which hardens and keeps the valve in place just like the metal stents. Perfect. Except you can variably work with this valve until it's perfectly placed.
Right. Gives you that adjustment factor.
It gives you an adjustment factor.
That's really significant. Now, are patients able to start accessing this product, or is it still in the development phase?
In the United States, it's still in the clinical trials. It's been developed, but it's in clinical trials via the SALIS trial. But in Europe, and it's been approved with CE mark approval in Europe, and implanted in over 2,000 patients with super results.
That's terrific. Little bit about you're currently their Director of Surgeon Relations. Can you tell me a little bit about what that job entails for you?
Many of these implants are being done completely by cardiologists, not only this valve, but other valves. And the idea is to have it done as a heart team with the cardiologist and surgeon. So my job is to basically bring to the surgeons the knowledge base about this and also all types of TAVR so that they will become involved. So that because we know that in Europe, in Germany, over 50% of the aortic valves are now being replaced not by necessarily this device, but by these new technologies, and there are a number of companies working in this space.
Great. That sounds like terrific innovation in the cardiovascular space. If people want more information about Direct Flow Medical, is there a website they could go to?
Yes, it's called directflowmedical.com.
Very good.
And it's a Santa Rosa-based company.
Santa Rosa, California.
California.
Very good. I'm here with Dr. Randall Chitwood. It's been wonderful talking to you. Very impressive career. The program is HealthTech Talk Live. I'm Jill Schiaparelli. We're being broadcast worldwide on iHeart Radio. We'd like to thank UBM Canon for their sponsorship of the Medical Design and Manufacturing Conference, and a special thanks to 1-800 Public Relations for their media and PR support. Have a great day.